Throat cancer is one of the most serious yet increasingly treatable cancers today. It affects the throat, voice box, or tonsillar area, but with early diagnosis and modern care, recovery and normal life are absolutely possible. In this video, you'll learn what throat cancer is, why it happens, early warning signs, treatment options, recovery journey, and how hope and knowledge can change lives. What is throat cancer? Throat cancer refers to cancers that start in the pharynx or larynx, the tubes that allow you to speak, breathe, and swallow. These include pharyngeal cancer, upper, middle, or lower throat; laryngeal cancer, voice box around the vocal cords. Most are squamous cell carcinomas, meaning they start in the flat cells lining the throat. If undiagnosed, they can spread to nearby tissues, lungs, or lymph nodes. Causes and risk factors. Several risk factors dramatically raise the chance of throat cancer: tobacco use, smoking or chewing, excessive alcohol consumption, HPV, Human Papillomavirus infection, especially in younger adults, Epstein-Barr virus, EBV exposure, poor diet lacking fruits and vegetables, occupational exposure to chemicals or dust, family history, and genetic susceptibility. The combination of tobacco and heavy alcohol is particularly dangerous. Early warning signs. Early throat cancer symptoms are often dismissed as a common infection or voice strain, but persistence is the key clue. Watch for persistent sore throat lasting more than 2 weeks, hoarse voice or voice changes, trouble swallowing or feeling that something is stuck, persistent cough or coughing up blood, lumps in the neck or jaw, ear pain or muffled hearing on one side, shortness of breath or unexplained weight loss, a sore throat that doesn't heal, and progressive voice changes always deserve medical evaluation. Doctors start with an examination of the throat and neck, often using laryngoscopy or nasoendoscopy, a thin camera to view the throat and voice box, biopsy, a small tissue sample to confirm cancer, imaging, CT, MRI, or PET scans to check extent and spread tests may also detect HPV or EBV to guide treatment planning. Treatment options. Treatment depends on the location, stage, and HPV status. Surgery, removing small tumors, or radiation therapy alone may be curative. Advanced stage, combined chemoradiation, targeting cancer cells with synchronized drugs and radiation. In some cases, partial or total laryngectomy, removal of part of the voice box, might be needed, followed by voice rehabilitation. Targeted and immunotherapy. Newer treatments boost the immune system's attack on cancer cells, especially for recurrent or metastatic disease. Life after treatment. Recovery is not just physical, it's emotional and social. Voice and swallowing therapy help regain function. Nutrition and hydration are essential for healing damaged tissues. Regular follow-ups detect recurrence early. Quit smoking and drinking alcohol. These steps dramatically reduce recurrence risk and improve survival. Support groups and counseling help patients redefine speech and confidence after treatment. Prevention and screening. Avoid or quit tobacco and alcohol completely. HPV vaccination for boys and girls protects against HPV-related throat cancers. Maintain oral hygiene and a diet rich in antioxidants, fruits, and vegetables. If symptoms persist beyond 2 weeks, seek immediate evaluation. Today, throat cancer outcomes are better than ever. Modern therapies mean earlier cures, preserved voices, and stronger futures. Never ignore persistent voice changes or throat pain. Early action saves lives. Your voice may change, but your courage stays the same. Speak your new voice of strength. Together we rise, stronger, louder, and cancer-free. If this video gave you knowledge and hope, like, share, and subscribe to spread awareness, because one view could help someone recognize their first symptom and seek life-saving care.